Hello everyone, now let us discuss about Chapter 4 Endocrine, Nutritional and Metabolic Diseases ICD-10-CM Coding Guidelines. Coming to the various sections of Chapter 4 are: first are disorders of thyroid gland, which are covered in the range of E00 to E07. Diabetes mellitus is covered from E08 to E13. Other disorders of glucose regulation and pancreatic internal secretion are covered from E15 and E16. Disorders of other endocrine glands are covered in the section E20 to E35. Intraoperative complications of endocrine system comes under E36 category. Malnutrition is covered under E40 to E46. Other nutritional deficiencies are covered under E50 to E64. Overweight, obesity and other hyperalimentation are covered under E65 to E68. Metabolic disorders are covered under E70 to E88, and post-procedural endocrine and metabolic complications and disorders not elsewhere classified are covered under the category E89. Chapter 4 mainly deals with coding guidelines for diabetes mellitus, and in the current session we will be focusing on the coding guidelines of DM. And we will cover the following topics. The first one is type of diabetes mellitus. Next is type of diabetes mellitus not documented. Diabetes mellitus and the use of insulin and oral hypoglycemics. Diabetes mellitus in pregnancy and gestational diabetes. Complications due to insulin pump malfunction. And finally, secondary diabetes mellitus. First, coming to diabetes mellitus. The diabetes mellitus codes are combination codes that include type of diabetes, the body system affected, and the complications affecting that body system. They should be sequenced based on the reason for a particular encounter. Assign as many codes from the category E08 to E13 as needed to identify all of the associated conditions that the patient has. Now coming to the various categories of diabetes mellitus are E08, which deals with diabetes mellitus due to underlying condition. Next is E09, drug or chemical induced diabetes mellitus. Next is E10, type 1 diabetes mellitus. E11 is nothing but type 2 diabetes mellitus, and E13 is other specified diabetes mellitus. For example, post-procedural diabetes mellitus. Coming to type of diabetes mellitus. The age of the patient is not the sole determining factor, though most type 1 diabetes develop the condition before reaching puberty. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes mellitus. In order to determine the type of the diabetes mellitus, age is not the sole determining factor. But majority of the type 1 diabetes mellitus, they develop before reaching puberty. For example, a 45-year-old is diagnosed with type 1 diabetes mellitus. And the second example is patient is diagnosed with juvenile diabetes mellitus. Here, though the age of the patient is 45 years and he is diagnosed with type 1. In the second case also, the patient is diagnosed with juvenile diabetes mellitus. In both the cases, the answer is E10.9, type 1 diabetes mellitus NOS. So, age is not the sole determining factor for determining the type of diabetes mellitus. This point should be noted. Coming to the coding convention when type of diabetes mellitus is not documented. Suppose if in the medical report, the physician does not document the type of the diabetes mellitus. If the type of the diabetes mellitus is not documented in the medical record, the default code is E11, that is nothing but type 2 diabetes mellitus. Let us see an example. Type of diabetes mellitus not documented. Office visit lists diabetic retinopathy with macular edema and hypertension on patient's problem list. The answer for this scenario is, the first code is E11.311. Because the type of diabetes is not documented, we are considering it as type 2 diabetes mellitus. So E11.311, which is nothing but type 2 diabetes mellitus with unspecified diabetic retinopathy with the macular edema. And additionally, there is hypertension on the patient's problem list. Hence I10, which is nothing but benign essential hypertension. Now, coming to the use of insulin or oral hypoglycemics in type 2 diabetes mellitus patient. If the type of DM is not documented, we need to quote type 2. And if the physician does not indicate the type but indicates that patient uses insulin. If the physician does not indicate the type but indicates that patient uses insulin, even then also we need to quote type 2 as default, and additionally we need to use additional codes from the category Z79. Z79.4 for long-term current use of insulin, Z79.84 for long-term current use of oral hypoglycemic drugs, and Z79.899 for other long-term current drug therapy for injectable anti-diabetic drug. Injectable anti-diabetic drug other than insulin. For reporting injectable anti-diabetic drug other than insulin, you have to use additional code Z79.899. One more important point is code Z79.4, that is nothing but long-term use of insulin. The term itself indicates long-term. The name itself indicates long-term. Should not be assigned if insulin is given temporarily to bring type 2 patient's blood sugar level under control during an encounter. And there are certain guidelines for using these codes. If the patient uses insulin or oral hypoglycemic drugs, if the patient uses both insulin and oral hypoglycemic drugs, you need to code both insulin and oral hypoglycemic drugs. Z79.4 and Z79.84. If the patient uses both insulin and injectable non-insulin diabetic drug, code both Z79.4 and Z79.899. If the patient uses both oral hypoglycemic drug and injectable non-insulin diabetic drug, you need to code both Z79.84 and Z79.899. If the patient uses all three, that is insulin, oral hypoglycemic drugs and injectable non-insulin diabetic drug, you need to code all three codes Z79.4, Z79.84 and Z79.899. Now let us discuss some example. The patient with diabetes mellitus is managed by metformin and Lantus. Here the correct codes are E11.9, type 2 diabetes mellitus, followed by Z79.4, long-term current use of insulin, and Z79.84, long-term current use of oral anti-diabetic drugs, because patient is managed by both metformin and Lantus. The second case is patient with IDDM, insulin dependent diabetes mellitus, on Ozempic, Lantus and metformin. Here Ozempic is the injectable anti-diabetic drug other than insulin. For this, we need to code additional code Z79.899 in addition to Z79.4, Z79.84 and Z79.899. First, we need to code diabetes code, which is nothing but E11.9. Coming to exceptions, code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control during an encounter. For example, type 2 diabetes mellitus with no complication, normally on oral metformin, is given insulin for 3 days to maintain glucose control while in hospital recovering from surgery. The correct codes are E11.9 and Z79.84. Here, insulin is given temporarily for 3 days. There is no long-term use of insulin. Hence, they did not use Z79.4 code. The next example is type 2 diabetes mellitus with diabetic polyneuropathy on insulin. Here the patient is on insulin, that is he is using long term. So the correct codes are E11.42, which indicates diabetic polyneuropathy, type 2 diabetic polyneuropathy, followed by Z79.4, long-term current use of insulin. Now coming to diabetes mellitus in pregnancy and gestational diabetes mellitus. Diabetes mellitus is a significant complicating factor in pregnancy. The pregnant women who are diabetic should be assigned a code from category 004, diabetes mellitus in pregnancy, childbirth and puerperium first, followed by appropriate diabetes codes. Now coming to various types of diabetes in pregnancy. In pregnancy, DM can be pre-existing DM or which has developed during pregnancy is called as gestational diabetes mellitus, and abnormal glucose tolerance test, GTT. GTT is performed during pregnancy, and if there is any abnormal glucose tolerance test, then also management is required. So the code for pre-existing diabetes mellitus in pregnancy is O24.0 or 1 or 3. There is still further expansion for the code. And the code for gestational diabetes is O24.4. Even this code is further expanded. And the code for abnormal glucose tolerance test is O99.81. Abnormal glucose complicating pregnancy, childbirth and the puerperium. Now let us discuss this table. Here is a 4-character code. O24.0, which is further expanded, indicated by dash. Now coming to the description of 4th character in this code. The 4th character 0 indicates pre-existing type 1 diabetes mellitus. The 4th character 0 indicates pre-existing type 1 diabetes mellitus. And the 4th character 1 indicates pre-existing type 2 diabetes mellitus. 4th character 3 indicates pre-existing diabetes mellitus unspecified. And the 4th character 4 indicates gestational diabetes. And the 4th character 8 indicates other specified diabetes. And the 4th character 9 indicates unspecified diabetes mellitus, that is whether it is pre-existing or gestational. Now coming to the 5th character. 5th character in this code category indicates whether it is pregnancy or childbirth or puerperium. 1 indicates pregnancy, 2 indicates childbirth and 3 indicates puerperium. If you see here O24.01, this is a 5-character code. Here the 5th character 1 indicates in pregnancy, 5th character 2 indicates in childbirth and 5th character 3 indicates in puerperium. The same is applicable for O24.1, 2, 4, 8 and 9. The 5th character 1, 2, 3, 1 indicates pregnancy, 2 indicates childbirth and 3 indicates puerperium. Now coming to the 6th character. The 6th character in this code range indicates the trimester. 1 for first trimester, 2 for second trimester and 3 for third trimester, 9 for unspecified trimester. So the description of complete code is O24.011 indicates pre-existing type 1 diabetes mellitus in pregnancy first trimester, which is nothing but less than 14 weeks. And O24.012 indicates pre-existing type 1 diabetes mellitus in pregnancy second trimester, which is nothing but from 14 weeks 0 days to 28 weeks. And O24.013 indicates pre-existing type 1 diabetes mellitus in pregnancy third trimester, which is from 28 weeks 0 days to until delivery. And O24.019 indicates unspecified trimester. The same is applicable for the fifth character, especially in pregnancy. Sixth character, especially in pregnancy. 1 indicates first trimester, 2 indicates second trimester, and 3 indicates third trimester. There is an exception of gestational diabetes mellitus. In case of gestational diabetes mellitus, the code range is different. We will discuss while we are talking about gestational diabetes mellitus. Now let us discuss an example. A 27-week pregnant woman presents for general follow-up visit. Risk factors include diabetes mellitus and the patient is on insulin. Here the correct codes are O24.112, which indicates pre-existing type 2 diabetes mellitus in pregnancy second trimester, because the patient is 27 weeks and this comes under second trimester, followed by E11.9 to indicate the type of diabetes mellitus, and Z79.4 to indicate long-term use of insulin, and finally Z38.27 to indicate weeks of gestation. Z38.27 indicates 27 weeks of gestation. Now coming to gestational or pregnancy-induced diabetes. The gestational or pregnancy-induced diabetes can occur during the second and third trimester of pregnancy in women who were not diabetic prior to pregnancy. Gestational diabetes mellitus is different from pre-existing diabetes mellitus. Here the diabetes mellitus develops during the second and third trimester of the pregnancy and usually gets resolved after the delivery. The diabetes can cause complications in pregnancy. Gestational diabetes can cause complications in pregnancy similar to those of pre-existing diabetes mellitus. It also puts the woman at risk of developing diabetes after the pregnancy. So codes for gestational diabetes are in the subcategory O24.4, gestational diabetes mellitus, and no other code from the category O24. Diabetes mellitus in pregnancy, childbirth and puerperium should be used or coded along with O24. That is, gestational diabetes is different from pre-existing diabetes. The other codes in the O24 category, they indicate pre-existing diabetes or unspecified diabetes. So whenever you code O24.4, you should never code other code from the category O24. Now coming to the various codes of gestational or pregnancy-induced diabetes. Here trimester specification is not given because the gestational diabetes occurs in the second or third trimester of the pregnancy. Hence the codes are further divided based on the control. If the diabetes mellitus, gestational diabetes mellitus in pregnancy is diet controlled, the code is O24.410. Here, the sixth character indicates the control. 0 if it is diet controlled, 4 if it is insulin controlled, 5 if it is controlled by oral hypoglycemic drugs. Gestational diabetes in pregnancy, unspecified controlled is indicated by 9. O24.410 indicates gestational diabetes in pregnancy diet control. And gestational diabetes mellitus in pregnancy insulin control is given by the code O24.414. Gestational diabetes mellitus in pregnancy controlled by oral hypoglycemic drugs is given by the code O24.415. And the gestational diabetes mellitus in pregnancy unspecified control is given by O24.419. Code Z79.4 long-term current use of insulin or code Z79.84 long-term current use of oral hypoglycemic drugs should not be assigned with codes from subcategory O24.4. This is important. Because the code itself indicates type of control, there is no need for additional codes from the category Z79.4 or Z79.84. Now coming to the next topic, complications due to insulin pump malfunction. So the insulin pump malfunction can lead to underdose of insulin due to insulin pump failure or overdose of insulin due to insulin pump failure. Underdose can occur or overdose can occur. So what are the coding scenarios when underdose of insulin is seen and overdose of insulin is seen? For underdose of insulin due to insulin pump failure, the following codes must be reported. The first from the category T85.6, a mechanical complication, followed by T38.3x6, underdosing of insulin, and additional codes for type of DM. In order to report underdose of insulin due to insulin pump failure. Insulin pump failure is considered as a mechanical complication of the device. For overdose, the codes are, the first is same, T85.6, a mechanical complication, followed by T38.3x1. For underdosing, it is 3x6. For overdosing, it is 38.3x1. Poisoning by insulin accidental. Followed by additional codes for type of diabetes mellitus. Now let us see the examples. A 24-year-old type 1 diabetes mellitus male treated in for hyperglycemia. Insulin pump found to be malfunctioning and underdosing. The codes are T85.614A. A indicates initial encounter, followed by T38.3x6A, and finally a code to indicate type of diabetes, E11.65. The next case is a type 2 diabetic patient found down with diabetic coma, brought into ED and treated for hypoglycemia, low sugar. Insulin pump found to be malfunctioning and overdosing. The codes given here are T85.614A, followed by T38.3x1A, and finally E11.641. Type 2 diabetes mellitus with diabetic coma. Now coming to secondary diabetes mellitus. Codes under the category E08, E09 and E13 can be considered under secondary diabetes mellitus. E08 mainly deals with diabetes mellitus due to underlying condition, and E09 is nothing but drug or chemical induced diabetes mellitus. E11 is other specified diabetes mellitus. Identify complications and manifestations associated with the secondary diabetes mellitus. Secondary diabetes mellitus is always caused by another condition or event. Example: cystic fibrosis, malignant neoplasm of pancreas, pancreaectomy, adverse effect of drug or poisoning. Now let us discuss secondary diabetes mellitus due to pancreaectomy. For post-pancreactomy diabetes mellitus, that is nothing but lack of insulin due to the surgical removal of all or part of pancreas. First we need to assign a code E89.1, post-procedural hyperinsulinemia, followed by a code from the category E13, and next a code from the category Z90.41, acquired absence of pancreas, as additional code. Let us see an example. Patient with newly diagnosed diabetes after surgical removal of part of pancreas. The codes are E89.1 followed by E13.9. This indicates post-procedural diabetes mellitus, followed by Z90.411, which indicate the acquired absence of pancreas. Now let us see the guidelines for secondary diabetes mellitus and the use of insulin or oral hypoglycemic drugs. In case of secondary diabetes mellitus, when there is use of insulin or oral hypoglycemic drugs, an additional code of category Z79.4 to identify the long-term current use of insulin and Z79.84 to identify the long-term current use of oral hypoglycemic drugs should be given. And assigning and sequencing of secondary diabetes mellitus and its causes. So while assigning, first we need to assign the cause. while assigning secondary diabetes mellitus due to, for example, secondary diabetes mellitus due to pancreaectomy. Here first you give the code E89.1, post-procedural insulinemia, followed by the type of secondary diabetes mellitus, and additionally acquired absence of pancreas code is also given. Secondary diabetes mellitus may be caused by an adverse effect of correctly administered medication, poisoning, or sequelae of poisoning. If the diabetes is caused by adverse effect of the drug, the diabetes condition should be coded first. If it is post-procedural, first E89.1 is coded. But if the diabetes is caused by an adverse effect of drug, the diabetes condition is coded first. Example is initial encounter for corticosteroid-induced diabetes mellitus. Here the code is E09.9. This includes drug-induced, drug or chemical-induced diabetes mellitus, followed by T38.0X5A, adverse effect of corticosteroids. Initial encounter. A indicates initial encounter. Thank you for watching. Please subscribe for further videos on medical code.